Hello, I'm Ali Motamedi, orthopedic surgeon and sports medicine specialist with Venture Orthopedics. Today I'm going to talk to you guys about rotator cuff problems. Rotator cuff is a group of muscles around the shoulder that passes under the shoulder blade and attaches to the arm. It allows for rotation and movement of the arm, and patients can develop problems with the rotator cuff. There are traumatic rotator cuffs as a result of falling, car accidents. We're not going to talk about that. What we're talking about is mostly rotator cuff problems from overuse and aging and degenerative process. So as the rotator cuff passes under the shoulder blade with repetitive movement and raising of the arm, the rotator cuff can get pinched against the shoulder blade, and over time people can develop bone spurs and inflammation in the bursa and sometimes tearing of the rotator cuff. Most of the time patients present to us either with gradual onset of pain or a sudden episode where the shoulder started hurting, and then they present with weakness, difficulty with certain exercises or range of motion, and a lot of times with sleeping at nighttime causes pain in the shoulder. So the first step is to evaluate, get a good history and physical examination, and then next step is to have x-rays. So x-rays sometimes at later stages can demonstrate bone spurs around the acromion or the shoulder blade, and changes over the arm, indicating that that area has been under pressure and the rotator cuff has gotten impinged and there's inflammation in the area. The next step for diagnostic purpose is an MRI, and the MRI would show a tear. This gray here is the muscle of the rotator cuff. The black is the tendon where it attaches, and you can see a clear gap in that area, and that indicates that there's a rotator cuff tear. The initial treatment for rotator cuff tear is to bring the inflammation down, improve the range of motion and strength, and that's done with activity modifications, modalities like ice and heat, physical therapy. Medical treatment would include medications such as anti-inflammatories or steroid pills to bring the inflammation down, and if that doesn't help and there's no real tears, then we can use a cortisone injection. If all else fails, then the last option is an arthroscopic procedure through a few small holes. We put a camera inside, clean the bursa, remove the bone spurs, and then eventually repair the rotator cuff using sutures and devices that reattach the tendon back to the bone. Thank you.